Okay, all right. We are back. Thank you very much, viewers. You are watching this special coverage from the Ministry of Health, and I am Ibrahim Abalde. Thank you very much for always following QTV. So wherever you are, we are happy that you're taking your time to watch this program. And we'll be discussing a very important topic, that is the primary goal of EPI, which is a very significant, when you talk about the health system of the Gambia. mbokk yi ñu ngi leen a jaajëfal di leen dalal si spécial programme bi nga xam ne fii si QTV lañ leen ko defal ba pare ànd si ak suñ ay naataango yu jógee si Ministry of Health dinañ waxtaane loolu di EPI bu yàggee tuuti ñoom dinañ indi ay yaatal lan mooy EPI ak yan jëm kanam lañ ci am kon ñu ngi amee fii suñ colleagues yi from the Ministry of Health.
Yeah, sure.
Good evening.
Good evening.
Naka ngeen def? I hope you people are okay. How are you feeling this evening?
Yeah, thank God.
Yes. Please introduce yourself, and tell us your position.
First of all, I would just say a very good evening to our viewers out there, and I am honored to be here today. I am Bayang Jong from the expanded program on immunization, the Ministry of Health.
Yes, and young lady on the left.
Okay, thank you so much. We are saying good evening to everybody watching right now. I am Fatou Ann from Directorate of Health Promotion and Education under the Health Communication Unit.
Yeah, so it's important today, this topic that we'll be delving into, a very significant topic. So first of all, make us understand what the EPI is.
The EPI is the expanded program on immunization. And before we honestly dive deep into what are some of our mandates and what is the aims and objectives of the program and what are some of the successes that were registered over the past years till date, I would just would want to say a very big thank you to every parent out there, especially the women, the mothers to those children. Remember, EPI mainly deals with children and pregnant women. So as we start the discussion tonight, I would just want to say to every parent, yesterday we started PIRI, which is the periodic intensification of routine immunization, and it's going to last for 6 days, and that is just within the Greater Banjul area for now.
Okay, that's an immunization.
So, yeah, it's an immunization.
It's a campaign that started.
Exactly, so we want to catch up with children who were never vaccinated, or those that really had started, but in one way or the other have not completed the vaccination series that they were supposed to be taking. So let them welcome the vaccination teams out there and know that we are honestly for the good of the children, because all our mandate is and our goal is to reduce morbidity and mortality, especially among the under 5s.
Yeah, so let's delve into the significance of this.
Yeah, like I said, the mandate of EPI is to contribute to the morbidity and mortality reduction from vaccine-preventable diseases. And vaccine-preventable diseases merely are those vaccines that could prevent so many diseases that were deadly then in the days. And what ignited the existence of the expanded program on immunization across the globe was as a result of the smallpox outbreak. Let me say it was a pandemic because it had affected every corner of the globe. And when that started, as science developed by a physician called Jenna Doe, did some experiments with the smallpox and realized it really had worked. That was how immunization started, and that was in the 1676, around that end. So in around mid-90s, or shortly before mid-1947, then the smallpox obviously was something that really disturbed, and the way the smallpox was eradicated on the surface of this earth was through vaccination. So from there, they realized, okay, this intervention we've taken, of course the Gambia was no exception, and vaccination started in the Gambia in the 1967. So those were the vaccines that we started, was the smallpox vaccine in the Gambia, the yellow fever vaccine, and the measles vaccine. And as a country, we really had registered high coverage since then in the days. So from there, in 1974, the world established EPI, but the Gambia established EPI in 1979. And we started with a few vaccines. There were about 6. There's the measles, yellow fever, the BCG, the DPT. These were some of the vaccines that were started with, and hepatitis B. But as time goes on, and also as development happens, science is very dynamic, and so every day so many things are evolving. As of now, I guess we're giving up to 14 antigens.
So I just want to understand how progressing are we as far as vaccination is concerned. We've seen the advent of COVID-19, and you know, most of the people are hesitant when it comes to vaccines since then. So what are some of the challenges that we're facing before we come to you?
Yeah, before I come to some of the misconception and also the vaccine hesitancy group that we had in the country, and of course it's across the entire group. We are only not facing the problem as the Gambia. But let's just look at some few figures that really had been happening. So I will just try to compare how far we have gone and how vaccination honestly had reduced the morbidity rate and mortality in the Gambia. When we look at when we look at like some figures, then in the days in around 1976, we were told like a report shows that, or surveys have shown that there were like 217 infants that would die due to these vaccine preventable diseases out of every 1,000 live births. And when it comes to the under 5s, over 360 perhaps of those children out of every 1,000 children would die. But when this demographic health survey was done in the 2019 and 2020, it shows out of every 1,000 children or out of every 1,000 infants, 42 were dying. From 200 and something to 42 infants that would die per every live birth.
Okay.
And when it comes to the under 5s, from 360 to 56.
So should we say we've progressed?
So obviously EPI has progressed. From 1979 to date, we honestly have seen a progress,
a drastic change. So let's come for you. I mean, what is your role? And we'll also want to understand how does community outreach play as far as vaccination is concerned?
Thank you so much. That is a very important question. Like my boss said it, Mbayang, the misconceptions and all the information that people are hearing, it is very good and very important that we strengthen communication when it comes to the uptake of these vaccines. Because we've seen recently a lot of people are having these ideas or some notions about these vaccines which are purely not very positive about the vaccine. So most of the time what we do is usually before we conduct any RCH program, we must make sure that we talk to the women. We talk to them about the importance of the vaccines that they are taking and what health benefits that it's giving to these children. Because like Mbayang said it, in the 1970s up to date, we've seen the major improvements that this vaccine has brought to us. Because we've seen the live births, the deaths and everything has been improving. And the deaths has reduced, and then the coverage for health, the indicator for the child health has also improved. Most of the time when we go to this outreach, we make sure that we talk to the women. And what we are seeing is also we want to include men also into this. Because we are seeing most of the time it's women that are going out there taking their kids, usually during the rainy seasons, or even when they are in their busy schedules, they make sure that they take these kids to the hospitals. that is why we are also trying to make sure that men are also involved in this immunization schedules or in these immunization programs, to make sure that these kids get what is these vaccines, and we know it's very important for their health.
Yes, this is very significant. Are we expecting another new vaccine to be administered very soon in the Gambia, Bayan?
Yes, we're expecting the malaria vaccine.
Okay.
Though not so many countries has introduced. A few did. I know Uganda did, of course. But then the Gambia also had applied.
Okay.
Yeah, we have already. We're on the process to complete the application for the malaria vaccine, and probably very soon we are also going to have the malaria vaccine.
So tell me, how does that malaria vaccine works? I mean, when you are vaccinated, it means you will never be affected by malaria again? Is that how it
Not
works?
really.
Or is it going to prevent you from malaria? How does it work?
Yeah, it does. So let's not only talk about the malaria vaccine, but let's generalize the vaccines here. How
does vaccines work?
Yeah, here the whole idea about vaccinating a child is to boost the child's immunity. Remember, already we had our immune system there. But then there's something that also you should like bring in to help the immune system of the child, because at some point somebody gets sick, not because of the immune system have not done their best. They really did their best, but at some point they were weakened by the antibody that must have invaded them. But with the vaccines, what it does is it prevents the severity of that disease from that particular individual. It doesn't prevent you from getting sick. Like in the instance of malaria, if a child had been vaccinated with malaria, this child would not face or have the complications of malaria, unlike the child that had never been vaccinated with malaria. And probably, if, may God forbid, the person can eventually die, if treatment is not really sought on time. So that's how the vaccine works. It boosts our immune system.
Okay, it will be very significant for us to understand what is the storage chain of these vaccines too. You know, how do we make sure these vaccines are stored properly, because they need an amount of temperature to make sure they are good. So how do we store this?
Yeah, when it comes to vaccine storage, the cold chain starts from the manufacturer down to the last child that takes the vaccine. And it is stored at a temperature of +2 to +8. So these are how the vaccines are stored. And there is also one thing that I really want to put out there, that the vaccines, you don't go to any pharmacy and find the vaccines there. The vaccines are only found with the expanded program on immunization. Even if there was a private facility that is doing some vaccinations, they must have gotten their supplies from the expanded program on immunization.
So what do we find at the drugstores? What do we find there? Sometimes
any kind of medicine,
you go and
but not vaccines. You really don't buy vaccines.
You are injected. I mean, what do you find there? Those are not vaccines?
No, those are not vaccines. Those are curables. Like you can be injected for prevention. That's what the vaccines does. But somebody can be injected to honestly to be cured. Probably you were sick. So we don't deal with the sick, we are dealing with healthy people. We are preventing.
But what is the biggest challenge that you face as far as vaccines are concerned? I just want to understand what are some of the biggest challenges, because fine, Gambia is doing well when it comes to vaccines. I can remember we've been vaccinated a lot of times during our schools. I mean, even school days, when they talk about vaccines, we all come out, you know, we give our hands and we are always vaccinated. We have a lot of marks when you look at my body. Yeah, sure. But now, I mean, I understand we are there, but we did not still get 100%.
Yeah, in as much as we are honestly registering successes over the past years, and Gambia had been one of the models for the sub-region, because we have been known for registering over 90% of immunization coverage. But of recent, we honestly had a downward trend, and obviously, when COVID hit, so many things really came with COVID. And up till now, some of the burden we are trying to recover from it. But then as a program, the real one thing that disturbs us is misinformation and myths. And honestly, it really had, it's doing some damages, obviously, to having mothers bringing their children for vaccination. And I would just say this one thing to everyone that is really listening to this program right now, that in anything that you're not so knowledgeable about, it is important for the expert or the subject matter specialist to really come in and talk about it. Because it's like people say a lot about vaccines when it's not really the truth about vaccines. And when you look at it too, when it comes to communication, there is that U-turn with communication. Because then, the only way you have health information was from the health personnel. But now you can tap anywhere, the social media, anywhere. But I would just say the social media is not the right place to have facts about health.
There are information that are not genuine.
They are really not very genuine. And everyone and anyone can post on the social media to say A, B, and C about the vaccines. But is that the truth about vaccines?
So what is the Ministry of Health doing, I mean, to make sure we counter vaccine misinformation?
Thank you so much. Vaccine misinformation, I can say it's one thing that is keeping us at a stake when it comes to this vaccination, like immunization, like Bayang said. But recently what we're doing, we have a call center where people call and ask whenever they have doubts and they want to clear their doubts or misinformation. We give them this toll-free helpline. That is the 1025. You call that line without any credit. It needs no credit. You just call, and then you have the service providers at your doorstep, at your service to respond to your questions. And also what we do is most of the time we do these caravan tours. We go to the communities to talk to them about the importance of these vaccines. Because we've seen even before I was born, before some were born, they were taking these vaccines. I seated here today, I can see, benefited from these vaccines. And all of us that are seated here. So it's very important to talk to the women out there to tell them that these information that they are getting from the social medias, from the WhatsApp platforms, from the TikToks or all the other social media platforms, whenever they have doubts in the information that they are having, let them contact the healthcare personnel. It is very important to contact those people because we are in a world where information is shared and we don't know which one is right. So to be able to pick up the good ones is very important for us to contact the first line. That is the healthcare workers. We are most of the time in contact with them. The women most of the time are so close to these health workers. You have an information that you know is not very clear to you, go to them and talk to them. And usually most of the time, whenever also a vaccine is introduced, we go out, talk to the women. I can recall the time that this HPV vaccine was out. There was a lot of misconceptions about it, that they are giving it to only women, to only girls, not boys. So it's like a kind of a bad control for the women, like in Africa and all that. But we try to make sure that we talk to these women and convince them to make them understand that we are just fighting what we call these cancers. And it's very important, like my boss Bayang said, it's very important. Let us just be very mindful of the messages that we are getting out there.
So let's filter this down to your personnel that administers these vaccines. How trained are they? How qualified are they in keeping records? To make sure these records are kept properly, and at the same time, simultaneously, how are they going to make sure these vaccines are administered with the right cold chain system?
Okay, I guess in the Gambia, we have public health officers and, of course, trained for that matter. It's either you graduated from the college or you are a direct BSc student. And alongside, you had so many practicum as a student that you have to do before you finally graduated to be a public health officer. And one of the mandates is just, immunization is just one of the mandates that the public health officers are doing. And even though you would have been trained for like consecutive 3 years or so, once you are posted as a public health officer, the EPI conduct and induction training. Just last month there was one. And each and every time these new badges of public health officers have been trained, they're always, posted, they're always trained before they are redeployed to their various health facilities of postings. So this is one thing that we are doing. And on top of that, we had manuals that even you can read and understand. So manuals are there for healthcare providers, or let me say immunization officers, to read and understand. And on top of that, there are a series of refresher training. Just last week, one was concluded. Whether new or old, you're brought together about 5 days or so and been refreshed on every EPI activity, especially with immunization. And we don't only stop at refreshing the minds of healthcare workers, but we also have some existing health structures called the community health structures, or the community health workers out there. We have the village health workers, we have the community bad champions, we had the village support groups, and the list goes on. Now we even have some signal detectors. So these are all people that have been trained to make sure they help healthcare workers to have, you know, what they really had needed in those communities. Because remember, we are here for the communities. We are here for the public. And the public too have to know that we are here for them. And how do they really have to get to know that? Is by putting them through to each and every function that we are trying to give out to them out there. And we also don't only stop there. As EPI, whether we have introduced a new vaccine or we are about to carry out immunization activities, these orientations of stakeholders that we do. And when you look at the stakeholder, here we are starting with the caregiver first. And so being the case, we are encouraging male involvement, because we all know we are Africans and we are Gambians, and the man here is the decision maker in the compound. And the lady cannot do anything in the absence of the husband. Or if the husband did not give consent, in as much as I wanted to take my child to the immunization ground and he says no, obviously that would not happen. And we are also involving men in the RCH to come and know that obviously the vaccines we are giving is not something that kills. It's not something that infertile somebody or impotent, probably the man. But it is just to prevent childhood
exactly. We should be definitely compensating each other as husbands and wife. As far as you did not go to the maternal, I don't know. I mean, there was a time I went with my wife to Bundu Maternal. It was more of men going and sitting. You know, they'll be teaching you certain things. I wasn't very comfortable anyway. I didn't like that one, but I have to do it because he said I have to be there.
Yeah, they're doing a lot in that, because what they want you to know is during the course of the lady's pregnancy, they want the man to know what this lady needs. Because so many things are happening out there. You can be an antenatal mother, like a pregnant woman, go and tell your husband, oh, I was anemic today because my HB was checked and it is low. The doctor said I should eat food rich in iron, like the liver. You can more like lulu. But if the man is there to explain to them, this is what these ladies goes through during pregnancy, it is, you know, it's also important, because it's something that you both has to, you know, go together, like till the time of delivery. And a lot happens along.
Absolutely.
It's 9 months, but honestly, a lot happens along.
True.
So this is the very time that this woman is also made to understand. You only do not have to come to the health facility as a pregnant woman, but immediately you give birth, something needs to be done for the baby. So this is all where you have to teach this woman what she needed, preparing herself for delivery, and after delivery, what does she need to do for the baby. And their immunization comes in. So this is the reason why. So you as a man, if you had accompanied your wife, you would know, okay, once my baby is born, the first thing I need to do is to get my baby vaccinated within 24 hours.
You are definitely seeing a husband material here, honestly. Everybody knows me at Bunduk. Yeah, so you wanted to say something.
Yeah, I just wanted to add on to what Mayang was saying, like the male involvement. Usually when they come, we make sure that they don't queue. Whenever a man is there, we see the man, we are usually happy because it's very rare to see them coming. So usually when they come, we approach them with that smiley face and all that, to make sure that we reassure them so that they can come back, and also they can be able to influence others to come, because it's very important to say that the woman should be the only person to carry on all that load is going to be very challenging. The woman is the one cooking, taking care of other kids at home. So if that woman also has to make sure that she's there at the RCH ground every month, it's going to be another challenge for her. That is why usually we make sure that whenever the man is there, we are so happy to take that person, and then we administer the vaccine for the child.
So recently, the Minister of Health released something on Mpox, you know. And please take us through how did it go with is it a vaccination campaign on Mpox, or can you take us through?
I wouldn't say much about Mpox for now, but I know as a country there was just one registered case.
Okay. And
we as a country also had started preparation way like months back to make sure if Mpox really had hit it, there were some strategies and also what other better word will I
preparatory
preparations were on the ground as to how to really take care of it. And even for the vaccines, we also had applied for the grant of vaccines to reach the country, and anything that has to do with logistic with the Mpox vaccination also had been done. The logistic team EPI did everything. It's just for like us to receive the vaccines.
Okay.
And once Mpox is there, if we think the need is there to have a mass vaccination campaign against Mpox, then everyone will be vaccinated. Yeah, sure.
Exactly. So it's important for us to do this in the local language.
Sure.
For us to at least, you know, give our local viewers an idea of what we're talking about. Mbokk yi di leen jaajëfal bu baax a baax yéen a ngi seetaan QTV Gambia lu ñu waxtaanee mooy vaccination yi nga xam ne Ministry of Health yooyu lañ ñu dee defal si réew mi réeru leen mbir ne vaccination lu am solo la yàgg na si réew mi fii te Gambia sax bokk na si réew yoo xam ne ñu dañ dee puugaroo ne sax ñun wàllum vaccination ñun ñoo si gën a xarañ. Tey nag ñoo am ñoom mbayaan from Ministry of Health EPI pour ñu mun ñoo waxal lan mooy njëriñ ñi vaccination yi ak nuñ ko dee defee ba pare yan gàllankoor lañ si dee am ak fuñ toll si wàllum vaccination bi yes mbaay.
Jërëjëf Bande may nuyu suñuy mbokk déglukat yi si jamono ji di leen wax rek man la seen doomu ndey di Mbayang Jom bàyyeekoo si buntu bi nga xam ne mooy saytu wàllum péngu yi si biir réew mi fii. ni ko Balde waxee comme maanaam liñ doon wax rek si angale lañ bëgg a bamtuwaat wax ko si kàllaama olof dinañ fi am pul xëy na dañoo faatu dina try pul wala ñu try soose su ko defee waxtaan bi gën a am solo ndi xëy na keneen mu ngi toog di seetaan waaye suñu emee si angale bi rek xamul li ñoo wax maanaam bunti balaa maa ñëw si kañ lañ door péngu bi si biir réew mi fii nii dina ñaax rek di jaajëfee waajur yi di leen ñaax ne dimba dooroon nañ an order periodic intensification of routine immunization lii tax nag ñu def péngu bii nii mooy pour fekk si xale yi nga xam ne ñooñu comme daanaka ni ko Fatou waxee xam nañ ne jigéen ñi ñu ngi bari soxla comme benn jigéen rek si kër yaay togg yaay fóot yaay bambaane yaay def lu nekk nga war a bàyyi loolu amuloo beneen loxo bu la jàppale ne damay dem noos te ñëpp xam nañ ne léegi-léegi di nga dem noos indu fa yaa ngi war a ñëw tooga comme maanaam borom bañut waaye dafa fekk mu xat so jigéen yi leneen yeneen dina tax borom du mun a dem noos waaye ñu ne kon nañ génn si fekk si leen ndax xale yooyu nga xam ne ñu ngi waroon a péngu te mënuñoo péngu ñu mun a jot seen péngu yi comme démba lañ door te dina am juróom-benni fan ñu ngi ko def si Greater Banjul area bi jëlee ko Banjul ba Kombo North yëpp si lañ ko fa laay toll for this time léegi-léegi nag dina ñëw def ko si réew mi yëpp kon ngeen xam ne on the 25th péngu bi dina jeex léegi rek ma door benn history rek laa bugg a indi si li taxoon half die.
waaw
xam nga lu tax half die ñëw.
Banjul half die.
so yellow fever outbreak moo amoon si biir réew mi.
ok
li taxoon half die maanaam genn walla googu yëpp. dañ si jotoon a ñàkk seeni bakken moo waral tuuri half die tey Banjul. te loolu was an outbreak bi nga xam ne yellow fever moo ko waraloon di feebar bi nga xam ne mooy di feebaru police te yàlla def bi réew mi datee péngu yi ni feebari police boobu doonoon na benn si ñàkku yi nga xam ne réew bi indi woon nañ ko ñu indi feebar yi jàddaara feebar ngas indi feebar bi nga xam ne day aar saxaat su bon si ñu di ko ooyee BCG indi feebar joo xam ne boobu tamit day aar njambataan that's the DPT, the diphtheria, the pertussis, and also tetanus. Tetanus nag ñëpp xam nañ ko daanaka ñëpp tetanus la ñoo wax.
Wow.
So si feebar yooyu lañ dooree woon di ñàkk xale yi and that was in 1979 te 1979 ba ren ji loolu maanaam nekk na about 45 years. 46 years. te gisoon nañ ne xale yooyu daan gaañu jamono yooyu soo gisee ñu naan diw dafa yara daal ba taxoon na yeneen xale yi ay turi yara daal lañ amoon ñu naan la kon kenn bëggul
waaw ñu jox la tur yu ñaaw
waaw just that because dafa taxoon ne jamono yooyu péngu amutoon ndik li nga xam ne moo di feebaru lafañ bi tamit bari woon na torop soo xoolee suñu mag ñi around the 60s ñu si juddu woon dafa fekkoon ne polio vaccine
amut
waaw so moo taxoon ñooñu ku ko amoon soo si jotuta ñaaka sa bakken di nga laago daal comme like differentially disabled nga am like di nga disable nga xam ne it's rather irreversible obviously moom soo ko amee rek noonu ngay dee te góoma jigéen bu gën a nga am doom boo xam ne yaa koy toppatoo keroog bi nga ko wasinee ba balaa mooy dem uyu ji boromam wala yu bari foog keneen war koo mën a jàppale te jamono dem na ba nga xam ne léegi fu mu toll ne boppa la ku nekk sa boppa ngay lijjanti kon maanaam yooyu lu am solo la ñu war koo aar moo taxoon bunta bii di saytu wàllum péngu yi si réew mi di EPI ñu jóg comme maanaam mu jógoon daal tey jii nag soo xoolee ñu ngi duuree woon si juróom-benni péngu tey ñu ngi joxe fukki péngu ñeent ndik ba pare nag ñu ngi compter nag because every new vaccine bu ñëw te gis nañ ne vaccine boobu it's disturbing because vaccine duñ jékki rek indi ko maanaam suñ ne ñu ngi bëgg a indi péngu malaria ndax malaria doon na loo xam ne du ñu gétteen la si réew mi dinañ ko séntu dinañ ko gestu malaria ñaata xale lay rey malaria lan la mun a def luy jafe-jafe malaria yooyu yëpp la ñooy mun a xool ñaata xale ko am luy jafe-jafeem su fekkee di magnitude is big huge then si la ñoo doog a indi péngo bi so péngo yi noonu lañ koy indi so booba léegi nag demoon na ba jamono ñëw feebaru lafañ yooyu ma doon wax in 2004 the Gambia was declared polio free country so waaye ba léegi nag taxut ñu bàyyi di def polio campaign last year rek lañ si géej te foog naa ne dinañ continuer di ko def ndik leena mooy we are doing surveillance nekkuñ di péngu xale yi rek di leen bàyyi dañooy péngu xale yi di leen topp ndik xale boo xam ne péngu nañ la te pare ñu gis feebar boobu si yow bugga nañoo xam lan moo waral feebar boobu si yow wala lu tax ba tey feebar bi ñu ngi koo gis te péngu yi ñu ngi koy joxe so surveillance boobu it's on and in the case of polio ñu ngee def environmental sampling léegi-léeg dinañ jël dayi xale bi waaye léegi-léegi tamit si sewerage system bi maanaam da di kama yi fi ñoo sotti seen
foofu lañ koy
fi ñoo xëccee foofu lañ koy jëlee ba léegi xool ndax feebar bi am na ku ko am because suñ ko gisee si ndoxi kama jooju rek muy mel ni kon keneen feneen
am na
moo ko génnee waaw moo taxoon ñuy waral di def campagne léegi-léeg du toujours nag comme nu mii noonu waaye léegi-léeg ñuy jóg rek di def campagne bi te di ñaax waajur yi yëpp ne EPI ñëw na fi te indiwu fi dara loo xam ne lu bon la soo gisee tey nga war a mun a toog di foga sa dina naan man ñaari doom laa bugg a am ñetti doom laa bugg a am dafa fekkoon ne dugunoo jigéen yooyu doon wasin in the 60s wallaahi léegi di nga fi gis jigéen bu am fukki doom benn xale moo koy dundal wala ñaar wala ñetta waaye tey jamono dem na ba nga xam ne yooyu yëpp a
nit ñi dem nañ ba confident ne sax suñu amee ñaari doom la ñëw dundal
ok te doo xalaat sax ne xëy na dina am lu koy ñëw génnee fii nii dara waralut ko gannaaw yàlla ak yonentam bi jigéen yaa fonkoon péngu te jamono dox na ba nga xam ne man xawma luy ngas xëy na man tey suma liggéeyutoon gentle lady here duñ doon mun a xam luy ngas because du gisewuloo ko fenn
waaw
doo mun a xam luy police gisuloo ko fenn doo mun a xam li nga xam ne mooy mandarga xale bi su fekkee ne dafa am ay jaddaaral miinuñ ko so tax na ba nit ñi dañoo toog sax nga war leen a mun a indil péngu ñu naan la damal toog xaar ñu si lopitaan yooyu yëpp la ñoo dégga jigéen ñi di ñëw wax waaye xam naa ne comme Olof Njaay nee na lu bon moom mbiraam duy yàgga boobu dinañ war a mun a start péngu indi 1979 balaa man maay juddu ba léegi ñuy péngu te péngu bi nekkul loo xam ne dafay wàññi ko waaye ay péngu yaa ngi dooree woon juróom benni péngu léegi yaa ngi compté ay fukki péngu ñeneent te ñu ngi compté bi dafay jéem
loo leen am pour wax si péngu yoo xam ne waxoon nañ ko fii ñu bëri ñu ne Bill Gates moo ñëw pour wàññi àddina bi yooyu yëpp wax nañ ko fii dégg nañ ko although yooyu soo ko déggee sa la nga xam ne loolu moom ay waxin la rek waaye there is no reality in it yooyu naka ngeen ko perceive as a health sector
as a health sector yooyu su munee am surtout nga war a ñëw ba jamono boo xam ne man léegi maa ngi génn surtout suñ waree am campagne nga dee dégga misinformation yu bari wax yu ñaaw sax doo xam sax ndax yi lii xel mën na koo téye surtout gémmiñ di ko wax yooyu lañ dee jànku wanteel waaye li ma la wax rek mooy ñun duñ daw duñ tayyi duñ xaddi dañooy génn waxtaan ak nit ñi ndéeg Olof Njaay nee na réeroo su amee rek waxtaan
dëgg la nañ waxtaan li si kaalama soose to man din fo mool ye mool mil yaalon koy mool jibe kan munat na bin nata jang ka sin ning jamaye kacha nyim vaccination la kola
abaraka bake assalamu alaikum mba fala gambianol be ngal konton niaje bin sita jang aketa kuute mi yaalon ko jata kende ani nga fo dorong aka kella ko mbele nyantalola tem nga amuta nga sembento yandi bidum nakacha mo minti wala nyin EPIT bos mayang ya fo nyame atala bunda minti atalbe mararing nyim pingo diola fannala amu bundale te mi alon ko niya bondi jata kende abunda to dorong kuol be nasila bakel katum bi niya jembijang pingole ku jamal le sabu na jata kende ar fengom ya lon ko biring abedati kan commencé tanung pengu jellela pengu wor o taymo min ko benda bosi ya fo nyamen ako kuran sasa jawbale dun tanung Gambia kono ja mi ya lon kay mu jamal fa half day min ya tin nan o taymo pengu wol te kirin no mi ya lon ko be mul tankala nyin kuran olal bare nyin EPI atamu bundala te mi ya lon ko be lorin ne pour kaje ko Gambia dingol bi ñim penku soto mobe tanka kuran jawbal kato ñum kuran jamal be jental sa en kamoel ntol man fellonde ñi yellow fever measles sol tonja kurangol kurangol lati miliyalon ko mamañol la watu walla ya a taymo ñing mabe tolle mabe tanu ngala taymol bari bi ngaje la ko kuran jawbal be jang wol be ay bota jele miliyatinna ñing EPI e tolle be lorin pour kaje ko mobe e tanka ñing kurangol ma courant odun say mbe damin tentin mbe ñing vaccine sol mildi kan wala ñim penku wolti itatal say fo tannin nan vaccine penku tannin nan katun safo ka commencé tanum penku woral Gambia dun aketa bankuti mi yalon ko asutetal Afrika be kono janniya ni ko penku odoro e ka Gambia le folo a tuuti ka santo mine yatinna do kulalle be loring ya jeko ñim pengol be dila dinni wala isaje ko tolle be kala na sama alfal because nda fono la ko laftan na banko e doku laftan na banko e tañato laftala nga futa dulato man na dinni wol makoy ñimu kulati mi ya lon ko jara kende abunda be lorin na pour ya jeko mobe ñim pengol ta mim ñim vaccine sa fanyade vaccine preventable disease wol e mu kulati mi ya lon ko akumma ya tabakele nin ko mbafola abe isa fo mbe mela janne bari
sa nyindo ha munta ko molu mel yalon ko man la nyinna al nim woldum alka wo manage nyaadile
komin na boss mbayang ya fo nyami sayinga bunda kibar janjam bunda dulal jamal la soto mel yalon ko nunto nsa fo ko no niye ko mo soto mel yalon ko aman koyma ika futela alfalla ma le futa jata kende abunda mol yayi makoy bari say ngajele ko social media platform de siyarinne ngajele ko kibar janjam bunda dulal be siyarinne mo jamal ka kibarol sotole dulal tole milia lonko e nyanta sotola a nyamminna aka nasile aka wala kadun wala kana ku jamal sabu isaje musa kibaro sotono social media comme WhatsApp wala nyen TikTok to itol so fon kumayandi no dina kumol milka bonan jata kende abundato comme na kibado sa fo nyame akoni be bankoto e ko ite lafta tanko la ni lafta le i protect e ko ite lata soldier la ita fanan na jata kende yala bundato la doctorol la mol la miliyalon ko tolle be jata kende ani nata ke fo la bundato e nyanta lala walla la bani ko be lala dula la wala la modo la miliyalon ko dol je bukeje fan e kay moy la dorebe diamu kan ita malo wala baluwo be nyaadire e be nyun kumo min fo kay ya soto mun tole foy karantale foy man karan wo be ta mawolon e ka wo kumo tala doro ya ci ga yake e fawtati a jama bi jaka mantora jama le nati lafta fa la gambia no le doron pour ngan hakilotu jata kende amol be lorinne so monda tilbulo wularo nimmin lafta kuma koyola e kate telleya ini diam wala Ministry of Health ye bunda kutole yala miyala ko lañi call center nsa fa metal demande mol sa kala muta na tare kumu soto miyala ko wala feng moy social media to miyala ko aman siniyem ye call isaje ko iniye diamu ifanansi la hakilo fanandila e kachande e kuma kendol foye.
So how busy is 1025 because when you talk about 1025 the mental picture that I have is COVID-19 you know I nkamira ko okay bu nekkee ne COVID-19 nga am rek time boobu nga mun a call loolu noonu so naka ngeen da ngeen de receive calls how often? Ñaata calls a day?
Very often. Because li xewoon during Covid doonoon na feebar boo xam ne dafa jaaxal ñëpp ba taxaw na kenn ku nekk bugga nga xam what is happening with Covid te léegi-léeg those concerned dañooy call pour laajte la pour ñu am si lu leer ñooñu loolu la ñoo def waaye duma si mun a sori tuuti borom call center ngeen nii
okay
muna wax yu bari
so I'll call jël receive a day if on average I mean
it's okay mun naa wax si wolof after then
mun naa wax si wolof amul problème
call center bi nag comme ni nga ko waxee mostly ñu bëri dañ dee foog ne it's just about Covid comme time bi Covid starté Covid moo tax call center bi ñu samp ko waaye ba léegi call center bi mu ngi ron 24/7 su fekkente ne boromam am na laajte nga xamante ne même léegi nii si inbox bi ñu ngi send message pura ñu send nañ message si phone si fan yi ñu ngi receive ay calls di laajte lan moo xew suñu laajtee rek dañ leen di jox response bi moo di ne inbox bi dugg na si réew bi mu di am nañ benn case waaye fu mu nekk nii dañuy ñaax askan bi rek pour ñu mun a xam ñu mun a am seen taxawaay ku nekk mun a taxaw aar boppam si li nga xamante ne mooy feebar bii nii because xamuñ comme que feebar bi dafa nekk feebar boo xamante ne dafa waalaate so loolu moo tax ñin 1025 call center ñing aketa bundaati mi ya lonko aba jata kende ya bunda molle tema anin banku mul ni mu moy kumu soto mi ya lonko fon soto mi ya lonka yi jakalle e kajela kol isaje ko moli i makoy ni hakilo fanan dile isaje ko isalon ko be min kila ila jata kende ala bunda la karo katon ko min ngafo nyame kuma jamal be findi kan ibukale ka findi dami abe mu minati pour kan na nyin jata kende ya bunda ka kele as ngalon ko Gambia ni nata jata kende ala karola mbe santole itata dawoda ka folo Gambia is at the top and ni nata ko EPI is the model in Africa so amu kulati mi alon ko ni mo moy jakal ko sot hani sayentente nying mpox min be takan ni moy jakal ko soto ko min nying mpox be nyaade la kata nyami e ka 1025 lokol amanke covid time o doronte hani say abata
because nde hani say camera 1025 womunum covid like
no.
You know I still have that covid feeling in me you know so albe muneke kam pour ka tandimol okay 1025 amanke covid damati
jama be je nin kata nin outreach programs wala nkadiyamu sati moliyenne banku moliyenne anu hana taranga flyer dada yikaje la duma je call 1025 for more enquiries wala kay tandiko amanke coming COVID-19 na watu len doron bar hani sai abunda nyim bijele mol bijele mi yalon ko ka tarajele watu watini kolke isi ima ko no yela kumol ya jabi bari anka bata ko soto jele wato dobji ka jele dol ka kolkele dinniwol ka kolke wato dobji bu ka femfo wol mu kol ya ko wolle bari ngaf mol hakilo bulandi kan doron ni la fay ni jakal ko soto doron ko Ministry of Health ko janni bitadula do
so finally nga sarodi wato nyim bantale fereng in short yamuna soto coming for janimbe programme da sorona
man daal gannaaw di jaajëfal suñuy client yi suñu waajuri jigéen yi ak xale yi di leen wax ne jërë ngeen jëf seeni taxawaay rafet na fi ngeen taxaw te fi ngeen téye foofu la nañ bugg di continuer di yóbbu seen doom yi.
Thank you jërë ngeen jëf thank you very much we apologize for that. I mean we didn't even realize we've exhausted the whole time. You know, we'll be doing this again on Thursday inshallah. Yeah, so thank you very much viewers. Do have a wonderful evening. Bye bye.